In this demonstration, I'm going to dry needle the Quadratus Lumborum, which is a lumbar stabilizer. The Quadratus Lumborum arises from the 12th rib and L1 to L5 transverse processes and inserts into the iliac crest. It's a muscle that hitches the hip and also lateral flex, and it's important in the management of low back pain and referred hip pain. So to identify the muscle, we're going to position the patient. We're going to extend the top leg and flex the lower knee. In order to identify the muscle further, we can place a towel that opens this region here, and we also can place the arm above the head and make sure that they keep the arm there, because the lie of the needle would change according to the arm position. So if she brought it here, there's a bit of relaxation. And if the muscles is too taut, you don't have to have the arm up there. You can have it lower down. So to identify the muscle further, I've drawn here the region of the spinous processes. Here we have T12, L1, L2, L3. L3 we identify by the intercostal line, which is around L3, L4. I also identified the erector spinae. You have the outer ridge of the erector spinae. So I just marked if you are needling L1 to L3, L4, 5, that region. Again, we discussed previously that needling L1, L2, L3, you perform corded and medially, because in this region you got the kidneys, and with inspiration, the kidney can traverse down to about L3. And also we have the lungs, the pleura, coming down posteriorly to T12. So we want to be away from that region. And what we also here is identifying the transverse processes. And once identified, I want to have these two fingers on the erector spinae. And to identify the muscle, I'll be asking the patient to hitch their hip and to feel if that's the muscle. You also get a bit of the erector spinae, but you're trying to identify which is the most strongest contraction. And again, relax. So I'm coming close to the 12th rib, and I can feel it's slightly taut around L1, and again, so it's a lot more taut around L3. So when I'm going to needle around L1, I'll be needling corded and slightly medially, and around L3 it will be going from lateral to medial in front of the erector spinae. So it's important when you needle that you needle in front of the erector spinae. Some people needle accidentally into the erector spinae, and it should not be further out because you got kidney in that region. So we palpate it, and I make a decision to needle L1 region of the Quadratus Lumborum and L3. So we palpate it. I'm going to mark with a guide tube. You might find the marking might change as you needle, so it's important to constantly palpate and identify the muscle before needling. So I'm just going to gently roll the erector spinae around the needle around L1 and L3. Again, the mark might change because muscles relax, but planning ahead what you're going to needle. So we're going to palpate, we marked, and we're going to swab. Allowing to dry. And then wash your hands and glove. I'm using a 0.3 by 30 mil needle, and it's a serine needle. And around the L1 region, I'm going to needle corded and slightly medially. Again, it's a clean technique, not a sterile technique. So I'm going to palpate again, and I'm inserting the needle corded and slightly medially in front of the erector spinae, and gently using a thrust technique and ensuring that when you relax, the lie of the needle is there. So I'm going to use a 50 mil needle. It's a water needle. So I'm going to release the guide tube here and ensure that the needle is safe. And I'm going to needle at the L3 region, laterally medially in front of the erector spinae. So I'm going to gently stretch this muscle. See my guide tube marked there. I'm telling the patient to breathe in and out. That's good. And gently tap in. Making sure you don't touch the needle. Got about 40 mil there. So once you needle, you can keep it for 2 minutes and ensure that the lie is good. So it's still away from the kidneys and the pleura, and also it's anterior to the erector spinae muscles. And then you can remove the needle and ensure there's no bleeding, and then reassess the movement. Just going to hit your hip again. So in the L3 region, it's a lot more relaxed there, even though it's been there for less than a minute. Again, that's good. Thank you.